Hello and welcome to this video presentation on enhancing patient safety through safe and clear communication. My name is Hisham Khalil and I'm a professor of ENT surgery and clinical education in the Peninsula Medical School, the University of Plymouth in the United Kingdom. This presentation is part of a webinar series for the Patient Safety Week and presented as part of the AMEE self-interest group on patient safety. I hope that you will find this presentation useful in thinking about aspects of effective communication and how these are really crucial for upholding and maintaining patient safety. In this session, we will cover the relationship between communication skills and patient safety. We will also reflect together on aspects of good communication and, on the other hand, on communication that is suboptimal or poor. We will also see some examples of when things can go wrong if communication is not right, and also examples of good practice. So is there a real relationship between communication skills and patient safety? Well, let's see. Well, communication or communication skills are our way of obtaining information from our patients. As healthcare professionals, we need to take a history from our patients. We also need to take their permission to assess them or to examine them or to carry out certain investigations. And it is also our way of giving them information about their care. But this is not where the relationship between communication and patient safety stops. Communication is also really important to establish a good rapport with our patients, and that they have a good experience and that they feel they can place their trust in their healthcare professional who is looking after them. And first and foremost, communication is really important to recognize the humanity of our patients. Now, we all recognize that communication is not just verbal communication, that non-verbal communication is also a very important aspect of the way we communicate to patients, to their family, friends, and to the other healthcare professionals who are looking after them. In fact, one study demonstrates that 55% of communication is related to our body language without us saying anything. So the way we posture ourselves, the way we look at patients, the way we smile or not, etc., may have a huge impact on our patients and how they respond to us, and may impact the way they perceive us and the way they take our guidance or instructions for them. We all have our preconceived ideas of what constitutes good or effective communication, what would put our patients at ease, what would make them feel comfortable of us being their healthcare professional and caring for them. So let's just take a moment to think about what are the elements of good communication. Okay, I know that you've all started to think of some of those elements. Let's see some of those elements as highlighted in the literature. So the literature highlights a number of characteristics for what constitutes good communication. A very important element of good communication is how we recognize the individuality of our patients. and to recognize that we are all special in that we have different beliefs, we have different expectations, we have different requirements, and so the recognition of the individuality of patients is paramount in effective communication. And that when we communicate with our patients, we do that in a holistic way, recognizing the patient as a whole, if that is a correct term. We all recognize that poor communication skills may have a very negative impact on our relationship with patients and on patient safety. The literature demonstrates that the most common reason for patient complaints is usually poor communication skills. This could be because patients perceive their healthcare professional not showing them due respect or not respecting their autonomy and their right to take decisions about their healthcare. Poor communication skills would also come into action if we fail to recognize the needs of certain patient groups, like those with learning disabilities or children, young adults, and elderly patients, for example. We would also be demonstrating poor communication skills if we fail to recognize, for example, that there is a language barrier with our patients and that they cannot clearly understand what we're saying to them in the language that we speak. This is also evident with patients with hearing or visual disabilities, where we have to recognize those disabilities when we are communicating with them. All healthcare professionals are regulated all over the world, and as a medic who lives in the United Kingdom, I'm regulated by the General Medical Council, and most other healthcare professionals in the UK are regulated by the Healthcare Professions Councils, but there are other regulators, of course, and this will differ in different parts of the world. And an example of what the General Medical Council's guidance says about effective communication includes that we have to ensure that we listen carefully to our patients and to their needs and to their requirements, that we share with them in a way that they can clearly understand information regarding their health care, and that we respond to any questions they have regarding their care, and that we ensure that we let patients know of how we are sharing their information with members of the healthcare team. Can you think now of other aspects that would constitute good communication skills? If you can, then please just make a mental note of that, and that will be very useful for the exercises that we'll now be starting. So, welcome to the first exercise in this presentation. We will be watching a video of a consultation with, unfortunately, a very upset patient. I would very much like you to make a mental note of the communication skills exhibited in this presentation, because they'll be very useful when we reflect on this video.
Would you like to come through, please? I'm very sorry we've been delayed so long. Do go through.
Fine, thanks. So, you know I've been waiting for there for an hour.
I can
Is this going to be my
apologise.
doctor?
It is, yes. This is
Right,
Mr.
okay.
Toll.
Right, please have a seat. Please, can you have a seat? I'm very sorry that you've been waiting, but unfortunately I haven't got your test results that you came back for today.
All right, okay. So, I waited there for an hour. I come in this room, you don't trouble yourself getting out of your seat. Are you a doctor? Can I see your badge?
Yes.
Are you a doctor?
Yes, of course I'm a doctor.
Can I see your badge?
Registrar in this department.
All right, fair enough. Noted. Now, You don't trouble yourself even to come and shake your hand. You don't show me any sympathy. Do you know I'm late?
Yes.
Do you know why I'm here?
Yes, you come for some test results.
And you lost my test results.
We haven't lost them, we just don't have them back yet. It's taking a bit longer.
Alright, okay. So you lost them?
No, we haven't lost them. They just haven't come back yet.
Alright, okay. And that's fine. I can go back home and life is okay. If that was you, if I have a child, what can I go and tell my child? Would I be with them next Christmas? You're not even troubled at all. I can't believe that this organisation even employs someone like you. You would have made it easy if you talked to me properly.
We're just going to book an appointment for you in a couple of weeks.
Oh, that would make everything okay.
Get your test results then, is that alright?
No, that's not alright at all. I need to see someone else. I need to speak to someone else. That's not the right way. I don't feel human enough with you.
Well, I'm sorry, but I'm sorry you had to wait, but we just don't have your test results today.
Okay. Alright, okay. Do you have, you're not the consultant,
No, I'm not the consultant.
Do you have consultants in this department?
Yeah.
Okay, I will make sure I speak to them. And let's hope we never meet again in life because I don't think you're fit enough to look after me.
Okay.
Thank you very much.
All right.
Right, I hope you have taken some mental notes regarding the communication skills exhibited in the consultation that we've just seen. Could the communication have been different? And if so, would that have resulted in a different outcome? Well, let's see.
Orlando, would you like to come through, please?
You know, I'll be waiting for an hour.
I'm really sorry, I can only apologise. Would you like to come and see Mr.
I
Tom?
don't think you're really sorry. I don't think this place is going right. Are you going to be my doctor?
Oh, Mr. Orlando, please come and have a seat.
Right, okay.
I'm very sorry for the wait. I know that we've been running late. I just wanted to apologise for that.
You know, I've been waiting for an hour and I've got the parking permit. I probably will have a ticket on my car now. I'm really not happy with this. I'm not feeling well. My daughter needs picking up from the school. And, you know, the word sorry does not make any sense to me. It doesn't pay me back any of that pain that I had outside.
Okay, well, once again, I must apologise. I'm very sorry for the delay. Now, going to why you're here, we sent off some tests last time you were here.
Yes, correct, yeah.
Unfortunately, we do not have the result back today.
You're joking. You're just joking. You don't have the results of the test. I waited for an hour outside for nothing.
I'm very sorry about that. There's been some delays in the labs.
Put yourself in my place. What would you do?
I fully appreciate that it's unacceptable, and I thought that we would have the results.
That's just not right. That's just not right. You know, people's life depends on you guys. You don't treat us as humans outside. You miss our notes, or I don't know what's went wrong with that test. Could it be because I have cancer? That's why you're not telling me, or what is wrong?
Well, look, we don't have any results back on that yet, so I'm afraid I'm unable to get any. I'm unable to give you any information about.
So what should I do now?
Well, look, I just wanted to say again, I'm sorry for this whole episode. Really, I'm sorry for the wait and the fact that we don't have the results. As you may have heard, we've been under lots of pressure lately, and it's just an unfortunate consequence of that. How are you at the moment?
I'm not feeling. I'm a million of things now. And most importantly, I'm not happy with all of this. Obviously, despite my problem, I'm as well. You know, not treated well. I don't know. What can we do to make sure this does not happen again?
Okay. Well, I'm very sorry about that. I'm going to book an appointment for you as soon as we have your results back. Okay, and we'll obviously prioritise this so that we get the results.
So
back
how
as
long are
soon
we
as
talking?
possible.
Are we talking another 6 months? Because I've been told about this before, and it took me 6 months to get here.
No, this will be within the next couple of weeks or so.
Okay,
within
couple
the
of
next
weeks.
two or 3 weeks. Okay.
Will you personally promise that you're going to report that to me?
Yes.
I need
yes.
someone because, you know, okay, fair enough, okay. And I'm not happy with the wait. I know you're saying it's not your fault. I don't want to take it all on you, but you understand my anger. So what can we do about it?
I completely understand that.
Yeah.
I'll give you some information for the PALS office who you can contact if you wish to make a formal complaint. Completely within your rights to do so. Okay.
Okay.
I can completely understand that. In fact, nurse, can we have a leaflet for PALS?
Thank you very much.
Okay. Once again, Mr. Orlando, I'm very sorry. I'll be in contact with you within the next couple of weeks, and we'll have your results.
Thanks very much. I really appreciate it. I'm really sorry, but you'd appreciate where I've come from as well.
Absolutely.
I'll just go for a drink because I'm really angry. Thank you very much.
Giving information to patients is an essential part of the work of all healthcare professionals. And for this, they need to use their effective communication skills. Well, let's see a video now of a doctor giving information to a patient before their surgery.
Hello.
Oh, hi, Mr. Michael. You come for your tonsillectomy consent today?
Yeah, that's correct.
Great. And you've read the leaflets?
I haven't yet. No, I was hoping you could explain it to me.
Yeah, we'll come to that. Did you get a date?
I don't think so. No.
You haven't had a date?
No, not
Right.
yet.
Oh, we'll have to get someone at the front desk to sort that out for us. That's okay. So you're coming for tonsillectomy, so we'll have to take your tonsils out. It's a surgical procedure, so we'll have to put you to sleep for that.
Okay.
And there's a few things that can go wrong, obviously, you know, being a surgical procedure. So
Okay.
so you'll have so you need to be aware that they might bleed, and it can bleed a lot, and sometimes we have to take you back to theatre because the bleeding has to be stopped again that way, and you can get infections, and
That sounds
there are
quite
some other
serious.
ones. They're all on the leaflets, as you know.
Okay.
So we can get you another one for that. So that's really it. Really, we just have to get you to sign, say you're happy. We'll get you a date, and then you can come back.
Okay. And it's all on the leaflet. Yeah.
Yeah, I'll get one of the staff to find one of them for us. It can hurt quite a lot actually, and as you're a bit older, sometimes it's a lot worse than if you're a child.
Oh.
But you know, we'll give you painkillers.
Okay. Okay. Should I sign then? Is that what?
Yeah, I've written it all out there so you can see. We put the sticker on. That's your name?
Yep, that's my name.
Is that your date of birth?
Yes. Yeah.
Great. So really, I just need to sign and you need to sign.
Okay. All right. Thank you.
All right, that's great. That's all really.
Okay.
Now we need to ask ourselves, after watching this video of a patient being consented for a relatively common procedure in ear, nose and throat surgery, tonsillectomy, did the doctor identify the needs of the patients? Was there any rapport established between the doctor and the patient? Do we feel that the patients had questions that they were able to ask? What about reading the nonverbal communication by the patient? Did the doctor identify any anxieties by the patients just through their nonverbal communication? These are all questions that may come through our mind. But let's see if things could have been done differently.
Hello, Mr. Michael.
Hello.
My name's Dr. Smith. I'm
Nice
one of
to
the
meet you.
ENT doctors in the clinic today. Come and have a seat.
Thank you.
Okay. So you've come to the consent clinic today for tonsillectomies. Is that
Yes.
bit of
Yes.
what you know?
That's what I'm aware of. Yeah.
Excellent. And they've spoken to you in clinic, have they, before about?
Not really. No, I was hoping you could have a chat with me about that today.
Absolutely, not a problem. Have you received a leaflet from us about tonsillectomy?
I haven't read through it yet.
That's okay. We can go through anything, and then we'll make sure you've got another one. Anything else comes up, that's not a problem.
Okay.
Can let us
Brilliant.
know.
Thank you.
So what do you know about tonsillectomies?
I know there's a bit of a risk of bleeding and pain, but I don't really know much about why.
Okay. So I'll start from the beginning, just so you've got the full picture.
Yeah, thank you.
You've been having lots of infections in your tonsils, so it's come to the time really that we think it'd be better for you to take them out than leave them there. And it is, as you said, it's a surgical procedure. So what we'll do is we'll take out the tonsils. And you're right, there is some risk of bleeding with all surgical procedures. In the case of tonsillectomies, it's in about less than 10%. So that's less than 10 people in 100 who have their tonsils out.
Right.
Can have a bit of problem bleeding afterwards. More often than not, it does happen on its own. There is a small chance needing to go to theatre again to stop the bleeding, and that's in the range of about 2 to 3 in 100, 1 to 2 in 100.
So there's a small chance.
It's a small chance. Something we need to tell you about.
Yes.
Not something that commonly happens, but something that, exactly as you say, there is a small risk of that.
Okay. Thank you.
And the other things you mentioned were the pain. We made sure to give you lots of good painkillers.
Great.
And we let you go home with painkillers as well. So we can make sure they're all prescribed from the hospital and then send you home with some.
So I won't have to worry about any of that then?
So it undoubtedly will be uncomfortable.
Okay.
And you will have some pain. However, it's important to keep eating and drinking afterwards. That helps the healing of where the tonsillectomy is done from. And we'll help you have lots of painkillers to try and support you through that period.
Great.
Okay.
Thank you.
The other things to be aware of is sometimes people can get an infection afterwards. As someone who's had tonsillitis before a lot, there is a risk of infection just after the tonsillectomy itself.
Okay.
And you can get some kind of white stuff on the back of tonsils. Often that's normal for the course, but if you were to become more unwell, feverish or anything like that, then it'd be important to see a GP afterwards and we can give you some antibiotics.
Okay, brilliant.
Okay. I think they're really the main things that we have to discuss with you. It's usually just a short time that you've been in hospital for, so often people are in overnight if it's done right at the end of the day. Sometimes it can be done as a day case, just depends really on the timing that you've got your slot in the day.
So I need to bring an overnight bag then?
Might well just popping in,
Okay.
a few bits just in case,
Right.
and then hopefully you won't need it.
Okay.
Okay. Have you got any other questions?
No, I think you've covered everything. Thank you.
That's okay.
Very kind.
So we've just got to go through the consent form now. So what we've got here is something we do for all surgical procedures. So we've just got your name here and your date of birth and all your details.
Yeah.
Okay, so what we've got here is that we've got you listed for a tonsillectomy.
Yeah.
Okay, so that's what we're going to do, and the risks as I've discussed with you
Yeah.
today. Okay, and then all we need to do is if I sign it and then you sign it, and then that's your consent form done before the surgery. Okay.
Okay, that's great.
So we just get a pen and I'll sign there. Just put the date and then you can do the same.
Okay, thank you.
Do you have any other questions or anything that's not clear?
No, everything's great. Thank you.
Okay. Did you want another copy of that leaflet if you've mislaid yours?
Yeah, that's very kind.
No problem. There you go. And if anything else does come up, don't hesitate to get in touch.
Okay, thank you very
All
much.
right, no problems.
Cheers.
Bye.
Breaking bad news is never an easy task for any healthcare professional, no matter how many times we've done this. However, there are certain principles that we have to abide with when breaking bad news. Let's see if those principles were employed in the coming video.
Sitaram.
Hi.
Sitaram, hi. So you've come in with chest pain and palpitations, is that right?
Yes.
I've seen your ECG. You've got something called Wolff-Parkinson-White. Can you see this on this ECG? See here, these are delta waves. You've got an accessory pathway in your heart and the conduction system. That's what's causing you to have palpitations. It's nothing urgent. It's not life-threatening at the moment. Just that you need to see a GP and they'll refer you to cardiology. Okay.
Will I die?
No, you don't. You just need to see a GP and they'll refer you to cardiology for this.
Is it something like cancer?
No, it's not cancer. It's an accessory pathway in the conduction system in your heart.
What does it mean by that?
It's where the electrical pathway goes from the top of your heart to the bottom of your heart and helps it pump. You've got an extra part, so it's going that other direction as well as the normal direction. And then so you're getting palpitations, makes you have tachycardia, causes you to have chest pain, which explains exactly what you come in with really. So as I say, it's nothing life-threatening. The acute that we have to admit you to hospital for. There can be risks that you can go into some dangerous arrhythmias. However, the standard protocol is just to get you to see a GP and refer to cardiology. Okay, are you happy to make that appointment yourself?
Should I have to make it on my own?
Yeah, if you're registered with a GP.
No.
So if you go along to a GP local to your area, you can register and then we can sort you out from there. Or I can arrange a cardiology referral from UD if maybe I'll do that then. Okay. You'll get a letter in the post.
Okay.
After watching the previous video, would you have done things differently if you were breaking this bad news to a patient? How did the doctor establish rapport with the patient? Was the patient given an opportunity to ask questions? Were things communicated in a clear language that the patient could understand? These are not just elements of effective communication, but they are core to patient safety.
Hi there, I'm Dr. Smith.
Nice to
Come and
meet
have
you.
a seat.
Thank you.
So I'm coming to the emergency department today with some kind of palpitations in
Yes, I
heartbeat.
had was racing hard. I was more concerned. Yes.
Has this ever happened before to you?
Not that I could notice. No. You know, when I was walking uphill, I just couldn't tolerate this. Yes.
And so we've been through all your history now, and we've examined you, and we've done heart tracing. And actually we have identified an abnormality on your heart tracing, which would explain why you're having these palpitations.
Right.
In your heart tracing, it shows us that you've got, so the way your heart beats from the top, and then it gets an electrical current that goes down to the bottom and then back up. You have an additional pathway in your electrical conduction system in the heart.
Right.
And this is causing your heart to get electrical signals where it wouldn't normally, and for you to go and have palpitations.
Okay.
Okay, and so we're pleased that your palpitations have now stopped, so you've gone back into your normal beating. However, now we know that, that your ECG suggests that pathway is there, it's important we follow that up.
Oh, do you think so? Okay.
Okay, so what we'll do is we'll refer you to cardiology to see them.
Okay.
Is this something you've ever heard of before?
No, not that. No.
Okay, so its name, if you happen to, if anyone asks you or you want to know more information, it's called Wolff-Parkinson-White. That's the name of the syndrome. It's named after someone a long time ago who identified it to start with, and that's what it's called. And it's this phenomenon where you do have this additional pathway of electrical activity.
Okay.
So we'll refer you to cardiology, and they will then see you again and assess you and go through everything. And there are procedures they can do to stop this extra pathway.
Okay.
So, and they'll be able to discuss with you more about that at the time.
Is it important for me to go through this, or because I feel okay now?
Yeah, absolutely.
Can I just leave it?
So there is always the option. It's always your choice. However, you have palpitations now already. That pathway is there, so there is always a risk that you'll have more palpitations. Sometimes these can be quite dangerous.
Okay.
This is why we should address it and look into it further and see what we can do about it. If in the meantime, between now and seeing the cardiologist, you have any more palpitations, more chest pain, anything like that, it's important to seek medical help.
Okay. So do you want me to come back to AMEE if there's
Absolutely.
Okay. Sounds good. Yeah.
Have you got any other questions I can help you now?
No, I think you've told me if there's any new palpitations, I should come back. Yeah, that sounds reasonably a good choice. Yeah.
Absolutely. Yeah.
Yeah.
I've got some information to give you as well about this.
Oh,
It's just so you can have a bit of reading if you want to find out some more information. There's a lot on the internet, sometimes it can be a bit overwhelming, so probably best to start with this kind of information first from, a good source.
Sounds perfect. Yes.
All right.
Thank you.
No problem.
Our final exercise of this presentation is about giving information to a parent. And this is not an easy task because parents, understandably, would be very anxious regarding the health of their children and any interventions that their children are undergoing. So this has to be communicated to them in a very clear, transparent, and sensitive way. Now let's watch the next video.
Hello, Mr. Papadopoulos. I'm Rachel, one of the ENT doctors. I'm just here to talk to you just quickly. We're taking your son to theatre, okay, because he's had a bit of a bleed, which is one of the risks of having his tonsils out. Okay, so I'm just going to go to theatre now.
What happened? Sorry, stop. So what happened?
Well, he's
What
bleeding.
sort of bleeding?
So he's bleeding from his tonsils, which is one of the complications of having your tonsils taken out, which we would have told you about before the operation.
Why do you need to take him to theatre?
Because he's bleeding, we need to stop the bleeding. So he's currently just on his way to theatre now, so I just need to go and run off actually because he's on his way there.
Oh, wait. I need to speak to someone else. Who are you, first of all?
So I'm one of the ENT doctors.
Yeah, I need to see the consultant. I mean, that's
Well,
ridiculous.
he's in
why
theatre
why
now,
is
so
he
he's-
bleeding?
Because it's one of the risks of the operation, which we would have told you about when we were consenting for the operation. So we've taken him round there now. The consultant's there, so
Can
I'm
I see
afraid you
him?
can't speak to him. He's already going round there to go to sleep, so you have to see him after the operation.
That's very difficult for me to accept, you know, because we thought it would be a straightforward operation. Everybody has a tonsil.
Well, he's currently
tonsillectomy.
bleeding, and I know you might not have thought that this might happen, but it has. So we just need to go around and stop the bleeding. That's the most important
Yeah, you
thing.
better do that quickly, please.
Okay,
All
I'll
right?
go and do that.
And just make sure
And you can see
my
your son
side is
afterwards.
fine
Yeah.
after that,
Okay,
okay?
yeah,
Just
I'm
make
going now.
sure it's fine.
How did this consultation go? I'm sure we've all felt for the parent of this child. Would we have done things differently? Was this an optimal communication skill from the healthcare professional towards the parent of a child? Let's see how things could have been done in a different way.
Papadopoulos?
Oh, hello.
Hello, my
Hello.
name's Rachel.
Everything
I'm one
okay?
of the ear, nose and throat surgeons. Yeah, so your son is Yanis, is that right?
Yeah, that's my son. Yeah, we're just having an operation.
Yeah,
We're just
okay.
waiting for
Good.
him.
I want to reassure you that everything's okay.
Okay, that's good.
Alright. However, I don't know whether you've been warned about this before, but after having your tonsils taken out, sometimes you can bleed after the operation.
Okay, yeah, I've been told about that.
Okay, so that's something you've heard about before.
Yeah. Is there anything wrong with Yanis?
So he's currently bleeding. Okay. But don't worry about my consultant's around there at the moment looking after him, as is the anaesthetist. There's lots of people there looking after him. He's awake, he's very happy, but he is
Okay.
bleeding a bit. Okay.
What do you mean bleeding? Is it
So he's just bringing up some blood from where we did the operation.
okay?
Alright, which is said unfortunately is one of the complications of this operation.
Yeah, we've been told about that.
Yeah.
Before.
So as you can imagine, bleeding can be a bad complication if it keeps going on, if it doesn't stop. Because you might lose a lot of blood.
What can we do to stop it?
Okay, so that's what I was going to get on to. So my consultant is around there at the moment assessing him, and he thinks the best thing might be to take him back to the operating theatre, alright, and pop him off to sleep for a short operation. I know it's not what you would have wanted to happen, but I want to reassure you that he's in a safe place, and he's well at the moment, but we want to do
Okay,
this
that's
operation to stop the bleeding, alright, so
Right,
that
just-
he can wake up and
Just do it quickly,
recover well.
please.
Yeah,
I
will do
want
that.
to see
Yeah.
him.
Yeah, do you want to come around and see him before he goes off to
Yes,
sleep?
please, if I could.
Okay, yeah, that's fine.
Thank you.
Now we've come towards the end of this presentation, and I want to thank you heartedly for taking the time to watch the presentation and engage with it. But now let's take a moment for food for thought about the importance of communication skills in upholding patient safety and how effective communication could really ensure that we provide excellent care to our patients, and how, on the other hand, poor communication skills can have the exact opposite effect. I hope that at the end of this presentation we can give some thought to how our communication skills impact our ability to give information to patients and what our patients experience in relation to our communication skills, and also how communication skills are important for having an effective healthcare team. And of course, our aspiration, all of us, is that all of these elements result in better healthcare delivery to our patients. Thank you. And a learning resource linked to this presentation is the Peninsula Communication Skills app, which is available to download for free from the App Store or from the Google Play Store. And it has the videos that you have seen in this presentation, but also some questions related to each video and a certificate to print afterwards. Thank you for your attention.